Did you know that a lot of people in Canada and the United States and even other countries are being denied access to medical care because they have Lyme disease and it is not recognized by their healthcare system? The CDC is still saying that you have to have all 5 bands show up on a test, even though they removed 2 very specific bands so that they could make a vaccine available to people that didn't work. And you still won't be positive for Lyme disease, even if you have those 2 bands and have never received that vaccine. Some of these bands are Lyme specific, and you only need to have 1 positive for a Lyme literate medical doctor to diagnose you with Lyme disease. And sadly, these people who are falling through the cracks of the system, sometimes their only choice is applying for medically assisted death. This is a travesty. This is incomprehensible, and we need to do better.
After 8 years of fighting and struggling with Lyme disease, Stephanie Lavoie refused to spend another summer locked up in her room, bedridden, unable to tolerate light or food, at the end weighing 59 pounds.
Qu'est-ce qui me fait continuer de vivre? Je vais être 100% honnête avec vous, c'est juste l'amour de mes proches.
On May 17th, surrounded by her loved ones, Lavoie made the decision to end her suffering with medical assistance in dying or MAID.
It was her B plan. She first wanted to heal till the day before she died.
Her family says she tried everything, including treatment in Mexico that failed. Despite being diagnosed with Lyme disease in multiple countries, her sister says she was missing 1 marker for the diagnosis in Quebec, preventing her from accessing treatment like intravenous feeding.
Is it ethic not to feed someone because of how the Quebec treats or considers that disease?
Lara Simard agrees Quebec could do more. The 29-year-old also requested MAID after she says doctors here failed to acknowledge and treat her symptoms. The former triathlete's life has turned around since receiving treatment in the U.S. She just got back on a bike after being bedridden for 3 years and wishes her friend Stephanie could have had the same chance.
She was abandoned by the healthcare system, and that we need treatment for all those people that suffers from chronic Lyme disease just like her.
Quebec's health minister insists the province has set up 15 clinics to treat the disease.
Lyme is a very complex sickness, and I think I feel very bad for that. But I think we are putting the clinics with the expertise that will be able to solve that.
Experts say a handful of Lyme disease patients in Quebec have chosen MAID. And without more research, knowledge, and prevention, some worry more will face the same fate as Stephanie. Gloria Enriquez, Global News, Montreal.